Good morning, Alicia Loxley with you. Victoria has today recorded 322 new cases and 19 deaths. The Premier is giving his daily update. We'll take you to that now.
Cumulative confirmed cases of coronavirus in Victoria, that's 322 new cases since yesterday. I'm saddened to have to report that there have been now 228 deaths due to this global pandemic in Victoria. That's an additional 19 fatalities since yesterday. Just for the purposes of clarity, there is an increase of 18 on the overall number of deaths. One death that was reported yesterday was removed from the tally due to duplication. They report very quickly, they do their level best, but from time to time we will need to adjust those numbers. That's why the tally won't quite reconcile. Of those 19 Victorians who have passed away, one male in his 50s, one female in her 60s, two males in their 70s, one male and six females in their 80s, and one male and seven females in their 90s. 14 of those 19 deaths are linked to aged care outbreaks. On behalf of all Victorians, we send our best wishes, our love and support, our condolences and sympathies to the families of those 19 Victorians. This will be an incredibly difficult time for them, and I hope knowing that all Victorians are with you is a comfort, some small comfort at a very difficult time. There are 640 Victorians in hospital, 47 of those are in intensive care, and 31 of those 47 are on a ventilator. A total of 1,820,598 tests have been processed since the beginning of the year, and we received 19,213 results since yesterday. There are 2,863 cases in aggregate with an unknown source. That's an increase of 105 since yesterday's report, so another 105 of those mystery cases, which are in many respects our greatest challenge. There are 1,065 healthcare workers who are active cases, so an increase on yesterday, but around that 1,000 number, which is where we've been for a few days now. There are 1,756 active cases in aged care settings, and the total active case number is 7,869. That, I think, deals with, and I should just say the metro versus regional split, or the stage 4 versus stage 3 split in terms of active cases. My latest advice is that regional LGAs under stage 3 are still around 500 cases, so that is relatively stable. Which is very important given our objective there to keep them low and drive them down even further. Again, can I just offer my thanks and praise to all of those Victorians who are following the rules, doing the right thing. It's very noticeable, both anecdotally, just by travelling in and back to where I live in the middle southeastern suburbs. There's just a fraction of the traffic on the road. A lot of the data confirms that as well. But it is really important that we all stay the course on this. It is a wicked enemy. It'll do everything it can to wear you down, and that's when it absolutely flourishes. When we let our guard down, when we are not, for instance, as signed up to these rules as we need to be. That's why I'm so grateful to those who are seeing this through and are making sure that in all the choices that they make, they're doing everything they can not to contribute to the spread of the virus, but indeed limiting movement, limiting case numbers, and delivering us the objective that we're all focused on. Just before I ask Jenny to speak to a number of changes, as I indicated yesterday, we'd get you an update on some changes around call to test, so where you can't get out of home or where it's difficult to get to a testing site. We have a number of arrangements that we've got in place, and we're taking those to another level. Jenny can speak to that in a moment. I just wanted to draw your attention to a couple of things we're doing. Firstly, I'm going to show you a couple of ads which I think give you a sense of how dynamic and changing our comm strategy is. This is about trying to tell a story to as many Victorians as possible that this virus does not in any way discriminate between people based on age, based on their otherwise healthy status. So many people who have become positive and had very bad experiences were otherwise healthy and were younger. As well as the second of the two that I think we're going to show you. Firstly, Sarah and Sam, who are a younger couple with a couple of young boys. They're both midwives at the Royal Women's Hospital. They can tell their story. June, who is an older woman, she describes this growing phenomenon where both here and abroad we're seeing more and more evidence that this is not like the common cold. Even for those who get past it, it can have and does have for many people lingering chronic condition type impacts on people's quality of life. So in addition to these advertisements, which will be run on every conceivable platform, there's also, I can inform you, that we've shot a number of ads where nurses, they in fact have shot these ads themselves at our request, who are speaking to multicultural communities in their own language. And it's about sending that message in its clearest sense from a healthcare worker who is the last line of defence out to those for whom English proficiency may be an issue, sending that message of follow the rules, do the right thing, make the job of our health heroes just a little bit easier than it would otherwise be. This is a really important step forward. We've changed many times to try and refine the message, to target the message, and we will continue to do that. But I would just say, certainly from my sense of things at the moment, is that people, a larger percentage, a larger proportion of the Victorian community are doing the right thing than was the case a couple of weeks ago. And I think that's something that we should all be proud of. This strategy is difficult, it's heartbreaking, it's very challenging, but it's the only one that will drive down movement across Victoria and therefore drive down case numbers, and that's what we have to be focused on. I know there'll be questions about whether the relatively low number today marks any point of significance. Just in advance of that, I understand where those questions come from, but I think we've all got to be very careful not to be getting ahead of ourselves. We have one day's data. It's always better to be lower than it was the previous day, but it is only one day's data, and the stage 4 changes, many of which only came into effect midnight last night, a number of others which came into effect midnight Wednesday last week. The oldest of these being the curfew that had been in place for 1 week yesterday, as of 8 p.m. yesterday. So it is still very early for us to be trying to measure the impacts of stage 4, but we're certainly seeing perhaps some greater stability that is a result of the cumulative impact of stage 3. And I think yesterday or the day before we shared with you what our experts tell us would have been the case. Many tens of thousands of cases if we had not gone to stage 3 and masks and the other settings we put in place. So that has achieved a lot. It just hasn't achieved as much as we need it to. It's brought some stability to the numbers, but we've got to drive them down so that we can reopen. Now I understand we have these ads, and I will now ask that they be played, and you can see.
I didn't think I had COVID. I didn't feel unwell. I felt like I was breathing normally. Because I was so badly infected, they had to get me on the ventilator fairly quickly. I was in the ICU for 32 days. I had a feeding tube on my face. I didn't know how serious it was. They thought that I might not live through the first night. Every day there was virtually no improvement. I'm fearful of brain damage. COVID has affected me physically. I have a weakness all down my right side. I have nerve damage in my right hand. Please listen to the medical experts because it's a terrible disease.
Dealing with COVID has been nothing like I've ever experienced before. It started off generally with the flu-like symptoms. I was almost debilitated with chest pain as well. The lining of my lungs became inflamed to the point where I wasn't able to fully inflate my lungs or exhale without excruciating pain. It feels like coronavirus has attacked every single one of my body systems. 4 weeks into my journey with COVID, I still feel like I'm incapacitated and can't care for myself. I have 2 little boys and I decided to isolate away from them. They're with their dad half the time and they're with my parents. Being separated from them for 5 or 6 weeks now has been incredibly hard. It's absolutely heart-wrenching hearing them say, "Mummy, why are people doing the wrong things? Mummy, why isn't the coronavirus going away?" If you're thinking about bending the rules, think about who you love most in this world and think about them in ICU.
So I think from those stories, all Victorians should be in no doubt that this is a matter of life and death, and even for those who are able to survive this virus, there are lingering consequences, there are lingering impacts for many. That's not every patient, but it is enough and it is random enough that that should be a timely reminder that we are all in this together. It does not discriminate, it doesn't stop, it is wicked, and it'll only be defeated if we are united, if we are determined, and if we see this thing through, if we stay the course. And that's why, again, I say thank you to everybody who, whenever they get symptoms, even the mildest of symptoms, they're coming forward and getting tested. If you've got mild symptoms, come forward, get tested, isolate until you get your result. If you are positive, then you need to isolate away from others. If you are anywhere in the state, anywhere, regardless of your circumstances, then you need to follow the rules. And they are different in regional Victoria versus metropolitan Melbourne. But if we don't follow these rules, if we don't all make our own contribution to limiting movement, the sheer number of people who are moving around the community, then we will not drive down these case numbers to an acceptable level that will allow us to reopen. I want businesses to survive. I want people back at work. I want people healthy. I want to begin that process of rebuilding our economy and community and setting us up for strength in the future. We simply can't get to that point unless we all play our part in making this strategy work. And again, that's why I'm so proud and grateful to the vast majority of Victorians who are. Again, those stories I think tell you a really powerful story about what is at stake here. Think about the person who is most important to you, and then think about them with a tube to help them breathe in intensive care for 32 days. That's how serious this is. That is how serious it is. It is a matter of life and death, and it is the greatest challenge that we have ever faced. Just before I invite Jenny to speak about some of our testing changes, I would again just remind, not that we need reminding, but I will make the point. We experience great adversity every summer, every single summer. We experience really difficult times as a community often. That's the nature of the place where we live and the circumstances that we have to confront. We are strong, we are resilient, we are at our best when we are one, when we are together, when we look out for each other, when we understand that how all of us act, how all of us behave makes a difference, that even individual decisions can have a big and profound impact on much larger groups. That's when we are strongest. And just as it's true in summer with fires, all year round, all too often with drought, it's true in relation to coronavirus and our collective fight against it. I now might ask Jenny to speak to some testing changes, and then of course we're happy to take any questions you have.
Thanks, Premier, and good morning. So we've seen some very powerful stories there that really bring home the message very clearly to the entire Victorian community about what's at stake here and the need for all of us to be united in a common purpose, and that is to defeat this terrible virus. So we are starting now some new testing programs to make testing for coronavirus even easier than before. We know that for some vulnerable people, some people who might be housebound due to disability or other chronic health conditions, it is challenging for them to be able to present to a testing station, and we want to make sure that every Victorian has the opportunity to be tested for coronavirus. So we are starting a call to test program that will enable someone to call our coronavirus hotline. They'll be assessed by a nurse through that hotline, and with a GP referral, we'll go to them. We will go to people's homes and we will ensure that they will be able to get tested within a 48-hour period. So this is designed to ensure that approximately 200 vulnerable Victorians every day will have access to this new testing capacity, making sure that people who might have limited mobility due to disability or might have other vulnerabilities due to chronic health conditions can get testing in their own home. It is a free service and will be available throughout Victoria. The way that people will be able to access this is, as I said, through the coronavirus hotline. There'll be a triage there, and with a GP referral, we will come to you. So just in terms of other changes, we're also providing new rapid response teams. We are responding to outbreaks that are occurring particularly in Melbourne, but right across Victoria through our regional public health teams. So we've got additional capacity there for testing. This is designed to essentially take a testing team on site to workplace and other locations and be able to test people more quickly and make it more accessible than ever before. So with these new innovations, we of course continue to roll out new testing sites across Victoria. We have more than 160 testing locations right across Victoria, whether they're drive-through testing sites, whether they're GP clinics or other locations. We want to continue to stress that it is important for people to continue to get tested, even if you have mild symptoms. Don't ignore them. Make sure you get tested at the earliest opportunity. Of course, there is now financial support available as well for people who are eligible if they're waiting for their test results, as well as people who may need to isolate at home if they test positive. And there's that additional $1,500 payment as well. So we are making it easier than ever before for people to get tested and then to get the support that they need as they wait for that test result. Thank you.